Hello and welcome to the National Press Club, the place where news happens. I'm Jen Judson, the 115th president of the National Press Club and land warfare reporter for Defense News. Thank you for joining us, both those here at the National Press Club's ballroom and to those viewing us on the live stream, for our headliner event with Secretary of Veterans Affairs Denis McDonough, as we commemorate Veterans Day this week. I should also note that it is the 40th anniversary of the opening of the Vietnam Veterans Memorial. We're delighted to have Jan Scruggs, the founder of the memorial, among our special guests today. We are happy to accept your questions and will ask as many as time permits. To submit a question, please email headliners@press.org and put VA in the subject line. Now I'd like to introduce our head table. We have Thomas Young, U.S. Air Force veteran, novelist, and commander of American Legion Post 20, the Pershing Post, here at the National Press Club. Dr. Lisa Thomas, Executive Director, Human Capital Management, National Cemetery Administration. Max Lederer, publisher of Stars and Stripes. Aaron Lee, PhD, Executive Director, Office of Human Capital Services, Veterans Benefits Administration. Kelly Kennedy, Managing Editor of The War Horse. Denis McDonough, we all know him, the VA Secretary. Tara Kopp, Pentagon Correspondent, The Associated Press. Over here we have Kevin Wensing, retired U.S. Navy captain and the National Press Club member who coordinated today's speaker. And Sue Fulton, Assistant Secretary for Public and Intergovernmental Affairs, U.S. Department of Veterans Affairs. Irene Lowenson, Marine Corps reporter for Military Times. Jessica Bongiorni, Chief, Human Capital Management, Veterans Health Administration. Ellen Mitchell, Defense Reporter, The Hill. And Michael Phelps, Vietnam U.S. Navy veteran and board member of Veterans in Journalism. All right. This past summer, President Biden signed the Promise to Address Comprehensive Toxics, or PACT Act, a landmark law that will provide disability compensation for veterans suffering service-related injuries and illness tied to exposure to burn pits and other air pollutants while serving in the Persian Gulf and post-9/11 conflicts. Radiation exposure for those people who served during the 1960s and 1970s, among others. This new law has prompted an unprecedented surge in disability claims. As Military Times reported last week, the Department of Veterans Affairs has so far received nearly 113,000 new disability claims, taxing a system already struggling with more than 144,000 backlogged claims. Our guest today, VA Secretary Denis McDonough, has promised to aggressively hire benefits processors to handle the influx of claims, a 20% increase over the number of claims filed at this time last year, and has instituted an automated system to cut processing times. The new provision also means that many more veterans will seek care of the VA's medical facilities, where a shortage of medical practitioners has led to long waits for appointments and medical procedures. Secretary McDonough last month called hiring a top priority and said the VA would look to pay increases, recruitment bonuses, and loan repayment programs to attract the employees it needs, including 45,000 nurses over the next 3 years. Secretary McDonough, who previously served as White House Chief of Staff under President Obama, has said he sees upholding promises to military veterans as a sacred obligation and notes that many continue to struggle with the lasting physical and invisible wounds of war, adapting to civilian life, homelessness, and substance abuse. Veterans' suicide rates, although dropping, remain unacceptable, he says. We look forward to hearing more about how the VA will address these challenges. Please join me in giving a warm National Press Club welcome to the 11th Secretary of Veterans Affairs, the Honorable Denis McDonough.
Good afternoon, everybody. Jen, thanks for that very kind introduction and for leading this truly great, important organization. Let me recognize the Press Club's American Legion Post and its commander, Tom Young, and all the veteran service organizations represented here today. You're critical to helping us serve vets, their family members, caregivers, and survivors. In just a little bit, as the sun starts setting over the Vietnam War Memorial Mall, they'll begin the solemn tradition of reading 58,281 names etched in those slabs of polished black granite. Among them, approximately 1,500 still missing in action. So in this 40th anniversary year of the Memorial Wall, I'm honored to welcome home Vietnam veteran Corporal Jan Scruggs. Jan agreed only to stay for that. And then he said, I've got work to do. So as he exits, let me just say to him and to all Vietnam vets, on behalf of a grateful nation, thank you for your courageous service, for opening hearts to Vietnam vets' heroic service, and for so well honoring your brothers and sisters in arms who died for this country and for each other. Words can never express the depth of our gratitude to each of you, our vets, for your courage, selflessness, service, and the sacrifices made by you and your families. But there is virtue in trying. In reminding everyone how these courageous men and women put their lives on the line for all of us. How much they gave, often their last full measure of devotion. How much each is willing to give, so the highest ideals of our nation might endure for all Americans. Veterans' valor is a constant reminder of true loyalty, true courage, true patriotism. Finally, speaking of courage, to all you courageous journalists here today, many of you have gone to battlefields, cities under siege, risking great danger to tell service members and veterans stories. And in so doing, you help us serve veterans better than we could ever do alone. So thank you for holding all of us accountable to all of the veterans. I agree with that. It's a privilege to be here as we prepare for Veterans Day. As we all know, Veterans Day is a day to honor vets, to remember what they've done for our nation, and to recognize that when those vets serve and sacrifice, so do their families, their caregivers, their survivors. But Veterans Day is something more. It's a call to action for all Americans to fulfill our sacred duty as Americans and serve veterans as well as they've served us. Not just on Veterans Day, but every day. So I want to talk about what we've done at VA over the past year to serve vets, as Jen has just given us a short summary of, and what we'll do this next year to deliver for them. With the President's leadership, Congress's support, the work of VSOs, and so many others, we're stepping up for vets. Since President Biden took office, we've delivered more care and more benefits to more veterans than any other time in our nation's history. When it comes to benefits vets have earned and deserve, we're processing their claims faster than ever before. In fact, VA processed 1.7 million veteran claims in fiscal year 22, shattering the previous year record, that year itself a record, by 12%. And we've gotten the claims backlog down to the lowest number in years. As Jen just said, nearly 144,000 claims as of this month. When it comes to honoring vets with lasting resting places that they have earned and that they so richly deserve, we're now providing almost 94% of vets with access to burial sites within 75 miles of their home. That's possible by building and maintaining our 155 VA national cemeteries, and by funding construction, maintenance, and expansion of 121 state, territorial, and tribal veteran cemeteries. And we've expanded our online Veteran Legacy Memorial Program to about 4.5 million vets, keeping veteran stories alive long after they've gone. When it comes to providing world-class health care to veterans, study after study shows we're delivering better health care for veterans than the private sector, which is why 90% of the vets who come to VA for outpatient care trust that care to be easy, effective, and based in respect for that veteran. And when it comes to advocating for veterans, President Biden's leading the way. He challenged us to make vets a core part of a unity agenda that rises above partisanship and politics. And he's hell-bent on fighting for vets with that same kind of indomitable will and sheer determination that they bring to the battlefield that we send them to. When it comes to our vets and their families, he's unyielding. All of that work adds up to the one statistic that will always matter most: veterans' lives saved, veterans' lives improved. And there's nothing more important than that. Now, we've made this progress by challenging ourselves every day with 3 questions. First, are we putting vets at the center of everything we do? That means making sure we meet vets where they are so they can access all we have to offer. It means making VA easy for vets to use with tools like new VA mobile apps that give vets access to their benefits right on their phones. It means making sure we're delivering for vets on time, every time, through initiatives like claims automation, cutting claims processing time for certain conditions from several months to several days. And as we approach the 1-year anniversary of the untimely death of Major Ian Fishbach, let me underscore the vital importance of this question: putting vets at the center of all we do. Every door at VA has to be a front door with multiple touch points to all of our services. And that means wherever a vet is treated, in a local hospital, a state hospital, or at the federal level, that care has to be integrated. It has to be coordinated, especially when it comes to mental health care. Vets and their families expect that, in fact, rightly demand it. And going forward with the new tools we have in place in Vision 10, they will have that. The second question: are we improving outcomes for veterans with everything we do? That means timely, I underscore timely, access to world-class health care, earned benefits, and the lasting resting places that vets have earned, no matter what. Because ultimately, vets will judge whether we're successful, not us. And the third goes back to something President Biden charged VA with the day I was sworn in. He said, Dennis, your job's simple: to fight like hell for vets, their families, caregivers, survivors. That's our North Star. So we ask ourselves, are we fighting like hell for vets? That's what we seek to do every day. Let me give you a couple examples. Jen foreshadowed them. First, we're fighting like hell to maximize access to world-class care for vets across America. We'll stop at nothing to make sure vets have the best possible experience wherever they access VA healthcare, be that at home, in the community, or at a VA. For those vets getting care at home, we're meeting them where they are, doubling down on tele-appeals, on telehealth, and, importantly, on tele-oncology. Let me tell you a word about that. VA clinicians have now seen more than 9,000 vets through tele-oncology, and we're expanding this life-saving tool to include clinical trials, meaning that rural vets are now getting opportunities that were previously unavailable to them for clinical trials due to their remote locations. We're also supporting our caregivers by expanding the program of comprehensive assistance, as we did last October 1, to cover all generations of vets, and by changing the policies so that even more vets get access to that innovative programming. For vets getting care in the community, we're working to make their experience as timely and as seamless as possible, so they get the care they need wherever they live and when they need it. And for those getting care directly from VA, we're going to modernize our facilities because vets in the 21st century shouldn't be forced to get care in buildings built early in the 20th century. We need a healthcare system with the right facilities in the right places to provide the right care for vets in every part of the community, every part of the country. So the bottom line with access is the same as ever. Vets who get their care at VA do better. Our VA clinicians know vets. In many cases, those clinicians are vets. And there's nobody better at caring for vets than them. That's one reason why vets who come to VA emergency rooms by ambulance are 20% more likely to survive in the following 30 days than those who are transported to private hospitals. So if anybody's asking where vets should get their care, please send vets to us. We're going to get them the world-class care that they've earned. Next, we're fighting like hell to end veteran homelessness, a phrase I continue to believe should not exist in our language. Our focus is on two simple goals: getting vets into homes and preventing them from falling into homelessness in the first place. We're making real progress. Last year, from this podium, I told you about two ambitious goals for last year to address veteran homelessness in LA, where there are more homeless vets than anywhere in the United States. The first goal was getting all of the roughly 40 homeless vets living on Veterans Row, a homeless encampment just outside of our hospital, into housing. The second goal was getting 500 vets in LA into housing by the end of the year. We not only accomplished those goals, we exceeded them, and used that to demonstrate that if we can tackle this problem in LA, we can tackle it anywhere. So we have established yet another set of ambitious goals for this year. We will place 38,000 homeless veterans into permanent housing by the end of calendar 22. At the end of September, the moment for which we have the most comprehensive data, we'd already housed nearly 31,000 vets, which is more than 80% of our goal, even though we're just 75% through the year, putting us on track to house even more vets than we anticipated. And we're not letting up. We're driving hard on homelessness prevention by increasing housing supply, making existing housing more affordable, and getting every veteran the wraparound services they need to prevent homelessness in the first instance. And last Thursday, we released the 2022 point-in-time census count. It shows that the number of vets experiencing homelessness on a single night in January was 33,136. Far too many, but an 11% decrease over January 2020, which was the last year a full pit count was conducted. That's the biggest improvement in more than 5 years. So we're not just taking our best shot at fighting veteran homelessness. With the help of partners like HUD, USICH, VSOs, local communities, and frontline staff in the VA's Homeless Program Office, we're going to end veteran homelessness. Because no veteran should be homeless in a country that they swore to defend. Not now, not ever. Third, we're fighting like hell to prevent veteran suicide. You saw VA's most recent report on veteran suicides in 2020, the most current data we have. A couple big things stand out from that report. First, more than 6,000 veterans died by suicide that year. It's devastating, unacceptable, and it's why this work is so critical. But that report also reminds us that suicide prevention is possible, that there's hope. There were 343 fewer veteran suicides in 2020 than in 2019. The second year in a row that we've seen a decrease. That's 343 vets alive today, getting a second chance at life. Nothing matters more than that. So we're building on that momentum. We're providing first-of-their-kind grants to suicide prevention organizations in communities on the ground across the country. We're ramping up our lethal means safety efforts to prevent warning signs from turning into tragedy. We're continuing to offer telemental health sessions to vets who want them. We're making sure they get their mental health care exactly when they need it, and not a second later. And we rolled out 988, the new National Suicide Prevention Lifeline that's connecting vets quickly and directly with the Veteran Crisis Line by, again, just dialing 988, then pressing 1. Because preventing veteran suicide is our top clinical priority, and we will stop at nothing. Nothing to ensure that vets not only survive, but thrive. Fourth, we're continuing to fight like hell to make sure all vets feel welcome and safe at every VA, not some veterans, all veterans. We're doing that by helping non-citizen vets stay in the United States where they belong, and making sure that eligible deported vets have access to VA benefits that they had earned. We're delivering care and benefits to those with other than honorable discharges. We're eliminating any racial disparities that exist at VA and setting up processes to prevent them in the future. We're making sure that LGBTQ+ vets are supported and well served across the VA. Last month, for example, we closed a gap in benefits for surviving spouses of LGBTQ+ vets, righting a wrong that's a legacy of the discriminatory federal ban on same-sex marriages. And we're getting women vets, our fastest growing cohort of vets, the care they've earned and they deserve. I agree with that. A few weeks ago, I visited the Military Women's Memorial for their 25th anniversary. Etched in the glass panes and the ceiling are powerful words of courageous women vets, words that the sun illuminates when the light hits that glass just right. None are more illuminating than the words of World War II veteran Lieutenant Anne Bream, words that always bear repeating. Let the generations know, he said, that women in uniform also guaranteed their freedom, that our resolve was as great as the brave men who stood among us. My late colleague and friend, and a great friend of America's veterans, Secretary Ash Carter, was committed to that principle. It was Secretary Carter who opened all military roles to women something women had already proved surely capable of. He'd be proud that women vets have been our fastest growing cohort, and we're very proud to serve them. But we haven't always done well by our women vets. So we're fighting like hell to serve them as well as they've served us. We've done that by taking important steps to make our healthcare facilities and programs safe, respectful, and welcoming to women vets, by providing women vet coordinators in every regional office to help them access benefits and provide assistance tailored to them, by having VBA dedicate one specially trained team to review each military sexual trauma claim, so we do not re-traumatize survivors who come forward to seek the benefits that they've earned. And by listening to VA healthcare providers and vets from across the country who sounded the alarm that abortion restrictions were creating a medical emergency for pregnant vets. That's why we made the patient safety decision to offer abortion counseling and, in some cases, abortion services to pregnant veterans and eligible VA beneficiaries. Because at VA we don't serve some vets. We serve all vets. And for far too long, too many vets who fought around the world to protect our rights, to protect my rights, my freedoms, have had to fight brutal battles here at home for their own rights and freedoms. But at VA, those fights are over. In this administration, no vet has to fight for the quality care and benefits that they've earned, that she's earned, no matter who they are, where they're from, or who they love. Last, but in no way least, we're fighting like hell to deliver for toxic exposed vets. One of your own has led the country in that fight, veteran and journalist Kelly Kennedy. About this time 14 years ago, Kelly started the thankless and rigorous task of holding people like me accountable when she published her first of dozens of articles on the casualties of burn pits. Over the years, her work catalyzed the national conversation on burn pits, educated us on the effects of toxic exposure on the battlefield in stark terms we could no longer turn away from. She told painful stories of service members deteriorating, dying, after exposure to poisons they breathed when they were deployed. She first introduced us to the enormous dangers of things we'd never heard about, like fine and superfine particulate matter. Chemicals troops may have been ingesting that sound as horrific as they are. Arsenic, carbon monoxide, carbon dioxide, nitrogen dioxide, benzene, formaldehyde, hydrogen cyanide, sulfur dioxide, sulfuric acid. Kelly told the human stories of soldiers, sailors, airmen, Marines, and families who were suffering, so we as a nation could not forget. Now I imagine part of that was about being a good journalist. There's a lot of them in this room. Guided by the spirits of greats like Joe Galloway and Dickie Chappelle, among others. And I imagine a lot of it was about compassion, deep devotion to service members and her fellow vets. And now, nearly a decade and a half later, as a result of her work, and certainly the hard work and heavy lifting, persistent voices of many, many others in this room, one of the biggest expansions of veteran benefits in history was signed into law by the President. A law that will deliver care and benefits to millions of toxic exposed veterans and their survivors. With this new law, VA has now recognized new presumptives of service connection for more than 20 additional health conditions related to toxic exposure, including, but not limited to, exposures like Agent Orange, burn pits, and more. We'll bring generations of new vets into VA healthcare and increase the healthcare benefits of many more. And that will result in better health outcomes across the board. We'll deliver benefits to more survivors of vets who passed away from toxic exposure, and we'll invest in our workforce and our infrastructure to deliver those additional services, modernizing 31 more VA healthcare facilities. This is a great thing. And I don't think it would have happened. Surely not happened now. Without Kelly's dogged pursuit of the truth, without our VSO partners' dogged pursuit of the truth. That's what I mean when I say that you all make VA better. Telling the stories that need to be told and holding us accountable to veterans and their survivors. Like anything else of this importance and magnitude, implementing this law won't be easy. That's why I have our chief human resource officers of each of the administrations with me on the dais today. They're going to come recruit each one of you to come work for VA. So we're counting on you for your help. To hold us accountable, yes, and especially to communicate to veterans and their family members what this bill means for them, what this law means for them and their families. This is what we want every veteran to know about the new law on toxic exposure. First, we want veterans and survivors of Central Command from 1991 to 2021, 30 years of war, to apply for their toxic exposure benefits right now. So far, veterans have filed nearly 137,000 claims under this new law. Second, and I want to be very clear here because it's important. We made all conditions outlined in this new law presumptive to August 10th, 2022, the day the bill was signed into law, rather than phasing them in over years, as the law anticipated. VA will begin processing benefits claims filed under this new law on January 1st, the earliest date possible. And beginning tomorrow, we're offering enrolled veterans a new toxic exposure screening, an important step toward making sure that all toxic exposed vets get the care and benefits they deserve, even if they don't know today that they were exposed, because vets have waited too long already. Third point, for vets who file a toxic exposure related condition before the 1-year anniversary of the signing, that is, for those who file before August 9, 2023, their claim and the benefit resulting therefrom will be retroactive to the date of signing, to August 10th, 2022. Fourth, I'm proud to announce for the first time today on National Cancer Awareness Day that we're expediting benefits delivery for veterans with cancer conditions covered by the law. This work is part of President Biden's vision for the cancer moonshot, which will end cancer as we know it. And it's part of his broader efforts across the government to do so. So we will expedite veteran claims if they have been diagnosed with melanoma, brain cancer, neck cancer, pancreatic cancer, kidney cancer, glioblastoma, head cancer of any type, respiratory cancer of any type, reproductive cancer of any type, gastrointestinal cancer of any type, lymphoma of any type, and lymphomatic cancer of any type. Fifth, any veteran, family member, or survivor can learn more about this new law by visiting va.gov/PACT or by calling 1-800-MY-VA-411. That's 1-800-698-2411. So that's what every vet needs to know about this law, and we need your help in communicating it. so that every veteran gets the care they need and the benefits they deserve. We won't rest until they do. It's not going to be easy, as Jen's introduction suggested, but we're going to do it. So from access to ending homelessness to suicide prevention to toxic exposure, that's where we're going. That's how we're going to keep fighting like hell for vets, their families, caregivers, and survivors. Now let me say a final word to the vets. Your honorable service in uniform set the example for the rest of us in this great country. In so many ways, you're the keepers of the national ethos. That deep and abiding sense of purpose you learned in serving, your camaraderie, your sense of teamwork that made you stronger together in combat and now in your communities. It's so unique in the country. Looking around, that's exactly what we need today. Camaraderie, truth, togetherness, true service, true patriotism. And it's something that all of us, each of us, can learn from, because we all are stronger when we're together, when we're one. So again, to all the vets here today and watching, thank you for everything. To the press club, my thanks for the delicious piece of fish and for all that you do, holding us accountable to vets and their families, their caregivers, and the survivors, telling their stories in the powerful ways you do. God bless each of you, and God bless our nation's service members, our veterans, their families, caregivers, and survivors. Now, Jen, I'm ready for those easy questions.
Thank you so much for your remarks. Can everybody hear me on this mic? Okay, excellent. So during your confirmation hearing, you said that you wanted to restore trust between veterans and the VA. So more than a year and a half in, do you think you're succeeding? So basically, how do you measure trust, and are you succeeding?
Yeah, great question. Here's how we measure trust. We use the V signal. It's a great innovation, going back to Secretary Bob McDonough. And this is what I mean when I said earlier that vets will be the arbiters of whether we're successful in what we do. And the bottom line is that we are trending positively on trust. What does trust incorporate? You all know because you take the V signal. But let me remind you, ease, timeliness, outcomes, i.e. effectiveness. And the third, emotion, meaning, do you feel respected when you come in? So in the aggregate, I feel quite good. Did you hear that little Minnesota there, aggregate? Sorry about that. My kids are laughing at me right now. In the aggregate, at about 91% for outpatient scores, we're doing pretty well. In the particulars, we got work to do. For example, the younger you are, the less you are to trust us. The more diverse you are, the less you are to trust us. The more female you are, the less you are to trust us. So that V signal tells us where we have to get better too. Last point, because I know you got another question. This new law, which allows us a new conversation with the most diverse, most ethnically and gender diverse force in the history of our country. It gives us another introduction, another opportunity for a new conversation, and we're going to make every opportunity of it, especially with those younger, more diverse troopers who spent the last 30 years of their lives fighting.
Okay, thank you. You said your first priority is veterans, but you've hit politics on both sides at every step while having to deal with inner workings of bureaucracy. You've had to go back to the drawing board on everything from electronic records to working from World War II era buildings to how to reimburse caregivers. Congress still hasn't confirmed an undersecretary of benefits, and now you're implementing the PACT Act. We've talked before about the president's efforts to be agile, to keep a team of experts from within each government entity available to quickly address challenges, and your push to restructure the decision-making process for presumptive status for disabilities, as well as your ownership of the decisions your executive board makes. So do you think that those changes have been effective in spite of politics? That was a long question, I'm sorry.
It's a good question. I hasten to add that we also do not have a confirmed general counsel. So I really hope the Senate confirms our general counsel. I think I'll answer the question like this, Jen. You can go to va.gov/trust. We now publish all of that data on trust. All the V-Signal data is there. In fact, John Bursler and I have been talking over the course of the last month or so about asking a team to come in and just red team that data for us. Are we harvesting right? Are we asking ourselves the right question? But maybe you all might do that yourselves and see what you come back with. And I'm going to let that scorecard determine whether we've been successful. The thing I think we have been successful at, that I think is very important, and that ultimately will contribute, I believe, to better outcomes, is we're much more transparent than we were. Now, as transparent as we should be, I don't know, you be the judge of that. But we're getting there. Monthly press conference, it's never happened, right? Regular interactions with our VSOs, my guess is if you ask a lot of people in here, they'd say, okay, right? Not perfect, right? But that transparency is by design. If you're seeing us opaque, that's meant to be bug, and I hope you'll call us on it.
How has VA's workforce changed in the past year? And to follow up on that, VA officials have said they have to hire 50,000 new people a year in the coming years. Given the tight labor market and the nationwide nursing shortage, what is the VA doing to recruit employees?
Yeah, thanks so much. I made quick reference to this in the remarks, but having Lisa and Aaron and Jessica up here with me, these are among our most important teammates on what is undoubtedly our biggest challenge, which is hiring. For the reasons you talked about, the market itself is tight. There's not enough providers for anybody, mental health care providers in particular. But VA is very competitive in a otherwise tight labor market. First and foremost, because of mission. Secondly, because of how we practice, meaning you're not subject to the fly-specking of some junior accounts manager at the local insurance company. You get to practice medicine in the interest of the veteran. So that makes us competitive, but we have to do better. We have to do better on how we onboard. In some places across the country, I'm hearing from our teammates that onboarding can take up to 4 months. It's too long. Congress has given us new tools in the last year, including in this new law for student loan repayment, for more competitive salaries, for better bonus structures. We have to make better use of that. And then ultimately we have a big piece of unfinished business which is our healthcare provider, our specialists are capped at an annual rate of $400,000, which sounds like a lot of money, surely for a guy from Stillwater, Minnesota. But it's not in this market. In fact, we are forced to end up paying a contract provider to see fewer veterans and pay that contract provider at greater than $1 million annualized. because we can't keep specialists at that $400,000 limit. So this is mostly on us. And thank God we have Jessica and Aaron and Lisa. There's not 3 better human resource professionals in the country. It's mostly on us. I agree with that. It's mostly on us. We're using these new tools, but we all need a little bit more help from Congress. The last point, I know you got another question. July, first month this year, that we added, this calendar year, that we added more nurses than we lost from attrition. But also over fiscal 22, we added, I think, 3,200 nurses net, right? July, our best year ever in hiring frontline service providers, that is to say, environmental managers, engineers, and VA facilities across the country. So these new tools work. We have them. We'll get to work on them. This $400,000 cap is a problem.
Has the VA been able to hire the 2,000 claims processors needed to handle the backlog, and will that be enough now that the PACT Act has gone through?
Yes. Thanks to all that work I just talked about, that's thanks to Jessica. What I'm about to talk to is thanks to Aaron. We have hired almost all of those 2,000. The challenge on top of that is twofold. A lot of those 2,000 come from elsewhere in VBA. So actually to hire the 2,000, we actually have to backfill quite a bit. But we're backfilling too. Second problem or challenge is that just hiring those 2,000, the 2,000 are overwhelmingly claims reviewers, but also technologists, HR specialists, data specialists that go along with them so that they're effective. But we have to also train those claims reviewers. And that takes, I think, what would you say, Aaron, like a year of full training before they're performing at highest levels. So yes, we've hired the 2,000. We're well down the power curve of getting them trained, but we have more work to do. And as your question suggests, that's not enough. We need at least that many more, if not more than that, to implement the PACT Act. But this was a really important innovation from Tom Murphy and VBA a year ago at the end of fiscal 2021. He said, we've got money available. Let's go hire now. So Aaron, Tom, Mike Frew, Brandy Terrell, that team, Willie Clark, that team has gotten us ahead of the power curve, which is why the backlog is as low as it is. But we got work yet to do.
Okay. This summer, Congress passed legislation allowing veterans who are stationed at Marine Base Camp Lejeune to sue the government for exposing them to toxic water on the base from the 1950s through the 1980s. As journalists cover the Camp Lejeune lawsuits, what do you want them to keep in mind?
Yeah, what I really want you to keep in mind is that provision is separate from the overall toxic exposure set of provisions. So I don't know if anybody's watched any football or baseball lately. I've watched a little. The advertisement on the Camp Lejeune issue is ubiquitous. And the use of the word claim in those advertisements, please do not mistake that for a VA claim, okay? That provision is expressly around a suit to be made whole in court from DOD. What we've been talking about today with the new toxic exposure law is all around benefits claims from VA and access to health care at VA. The Camp Lejeune provision does not address either of those. So I hope, we really need your help in disaggregating the two. We're taking a lot of learnings from our VSO teammates on that question, and we'll stay on top of it.
Okay. Is the VA anticipating the toxic exposure bill is going to compound its backlogs for healthcare? And if so, how is it planning to deal with that?
Yeah, so it's a really excellent point. So we have we will be on the clock, as it were, for scoring backlogs for the benefits side of this law as of January 1. We have a little bit of forbearance because the increased access to health care on the VHA side of the law is really layered in over the course of the next year. So the first thing we're going to do is make maximum use of the time that we have to hire. And this is what Jessica is spending all of her time on. Recruiting docs, recruiting nurses, nurses of all stripes and all levels. So the first thing we're going to do is take advantage of that time. The second thing we're going to do is make sure that we're being fully honest with all veterans and all of you on how we calculate wait times. We updated the methodology and published a new methodology on our website in June about how we calculate those wait times. That will then help veterans make some determinations for that access. Third is we're also getting better at ensuring a vet who needs access to care and has an opportunity in the community, that happens in a more timely way and that care is actually coordinated into that veteran's record overall. So those are the three things we're doing. I do not believe it will increase wait times. We'll stay on top of this, but again, this is one of the things to go back to this accountability metric. This is why we wanted to update that data, make it available to you on the websites, and hold ourselves to account on that question.
Okay, after the January 6th attack on the Capitol, there were calls to take away benefits from veterans convicted in that attack. Where does it stand? In other cases, does conviction for criminal activity cost a veteran his or her benefits?
Yeah, the statute's quite clear on this. There's a law that says a veteran indicted, let alone convicted, for insurrection, is not eligible for benefits. So in those instances where a veteran, I don't know the number, but there has been a number to date. I want to say it's between 7 and 15. We communicate this to Congress. We obviously communicate this to the veteran, but the law is cut and dried on this. If you are indicted but not convicted, well, then you'd be back eligible for benefits. If you are indicted and convicted, you don't get access to those benefits. As I said, the law is cut and dried on this, and we are a nation of laws, and we will implement those laws.
In the Virginia congressional race, there's a veteran who is campaigning, not in uniform, but in Army look-alike pullover with camouflage sleeves, and his military awards and photos are behind him. And he's just one of many emphasizing military backgrounds as a reason to vote. Are you concerned that veterans are politicizing the military when they campaign like this?
I want to be careful I haven't actually, I've seen a lot of ads, but I've not seen those. So I'm actually not even sure I know which race you're talking about. So I want to make some general comments without commenting about specific races. You all know I am not a vet. If you don't know, you do now. When the president told me to take the job, that's the way it works when the president tells you to do something, you do it. I told him that I thought I wouldn't get confirmed because I'm not a vet. He said, well, let's see what happens on that. We'll figure that out. For a year and a half now, I've gotten a chance to travel across the country, including to many places, even in my own country, I've not yet been. And in every corner of the country, one sees interesting things, and one need not scratch hard to see veterans making those things happen. And that has nothing to do with politics. It has to do with the things that I talked about in my speech: camaraderie, a sense that we're better together than we are as one, as individuals. A sense that there's a certain dignity that comes with public service, that there is strength in recognition of truth, and that there is indeed truth. So, as I said, I've seen in every corner of the country veterans, as I said in my remarks, manifesting those strengths, and even I called it that national ethos. And that has nothing to do with politics. And I hope we don't let politics enter into that.
Right. As of September, VA is offering abortions to veterans and dependents in cases of rape and incest, or when necessary for the health or life of the mother. Is VA considering expanding abortion access to other pregnant veterans and dependents? Or in your view, would that be impossible under current law?
Yeah, so thanks very much. We at VA published a rule that permits abortion counseling and in certain cases, abortion services. Those cases are rape, incest, life, or health of the veteran. We are in the process of now having collected several tens of thousands of comments, public comments about that rule. So we are responding to those comments. So I have to be careful, consistent with what's called the Administrative Procedures Act, which allows us to make regulation in this way. I have to be careful not to add any new analysis to this case and this rule until we have processed all those comments. So we made, but I can say this, and I will say this with conviction, we made this decision from a simple perspective, which is the overriding concern we have as a healthcare system is the patient safety of our veterans. Our providers indicated in this case that the confusion resulting from the Supreme Court case earlier in the year was creating a health emergency for pregnant veterans. In order to address that health emergency, we took this step. We will obviously look closely at these comments. We'll look closely at future comments if we need to, but we'll look very closely at these comments right now, react to them, and then finalize this rule.
Okay, thank you. And we are almost out of time, so I'm going to ask one last question from the audience before I close. You mentioned in your speech efforts to make women veterans more welcomed at VA. Where do things stand on efforts to change the VA motto to gender-neutral language? That comes from Leo Shane, Military Times.
Okay. Well, look, this is off the record, but I'm just kidding. Leo knows that I only speak on the record.
Don't make Leo's head explode.
I have indicated that we will change the motto. I've indicated that how we change it is important to me. So we are in the process of consulting now in an even expanded way with veterans, including women veterans, and with our employees about that motto. I don't have news today on when that process will culminate, but we will change it.
Okay, thank you. Before we conclude today's discussion with a final question, let me take a moment to thank Headliners co-team leaders Donna Lineman-Legere and Lori Russo, the organizer of today's event Headliners member Kevin Wensing, Club Communications Director Kate Helster, and Club Executive Director Bill McCarran. We also want to let you know about some of our upcoming events. On Friday, November 11th, join us for a Veterans Day dinner featuring celebrity chef and veterans advocate Andre Rush. And on Wednesday, November 16th, we'll host longtime Washington journalist Owen Ullman, who will share his insights about Treasury Secretary Janet Yellen, the subject of his new biography, Empathy Economics. It's also my honor to present you with your second National Press Club mug.
Awesome.
Now you have a matching set.
Thank you.
And for our final question, how will you be spending your Veterans Day? And do you have a particular tradition for that day that you carry out to honor Veterans Day?
Yeah, thanks so much. Well, I'm really honored to be able to spend Veterans Day again this year as a very small part of the official program at Arlington National Cemetery with the Vice President, Second Gentleman, and with Dr. Biden. We'll start in the morning with some workout with some vets. We'll have a breakfast at the White House. We'll have the very moving ceremony at Arlington National. And then for the reasons that you mentioned earlier, this being the 40th year of the Memorial Wall, I'll be spending some time with Vietnam vets in the afternoon, and then commemorating the opening of the new Native American Veteran Memorial up near the National Native American Museum. The thing I particularly like about this, I can only do this with one of my sons this year because the other one of my sons and my daughter are away at college, but I spend the day with my wife and our son. And I will say that I will long remember the 8 veterans we met at the Memorial Wall last year. 8 of them who had served in different years in Vietnam had just then met each other, and it was quite clear to me that they had a deep and abiding bond as a result of their service on behalf of the country. So that is a very profound thing to experience, and I was very gratified that our sons, young men, had a chance to witness that.
Thank you so much, sir. And thank you for all that you do for veterans. And that's the close of our lunch. Thank you so much, everyone, for joining us today. Happy Veterans Day.